America's healthcare system is gravely failing black mothers. Black women are 3 times more likely to die during labor than white women. But even those moms who make it past the delivery room are not in the clear. Health experts say about 70% of new moms encounter health complications within the first year of giving birth, and black women are disproportionately affected. Today, Congresswoman Robin Kelly introduced the bipartisan Helping Medicaid Offer Maternity Services Act, or Helping Moms Act, if you want to be able to say it for short. It would permanently expand Medicaid coverage for postpartum care. Currently, the current law covers up to 60 days, but her plan would cover the entire first year after childbirth. I had a chance to speak with Congresswoman Kelly earlier today. Congresswoman Kelly, thank you so much for joining us. You are a sponsor of the Helping Moms Act, which would allow states to expand Medicaid for postpartum care up to a year. Right now, I think they have 60 days of postpartum coverage under the law. What would this do, and what is the purpose of this bill?
Yes, right now, in most states except for the state of Illinois, postpartum coverage is up to 60 days. But when you speak to obstetricians and gynecologists, they'll tell you that the postpartum period is really up to a year after a mother gives birth. And 70% of moms do have some type of complication, and it's not always during childbirth or 2 months after. It could be 3 months or 4 months or 5 months. We've heard many, many stories. So this would give moms the ability to go to the doctor when they need to go to the doctor, not just when they can afford it. And it will save lives.
So under the existing Medicaid laws, just to help our audience to understand here, if a mom suffers some medical complication, they could still go to the hospital. Is that right? Or does this change that? Or is it somehow under the present law they are prohibited from seeking care?
Well, this deals with postpartum coverage. So let's say, a woman is feeling sick. You can always go, yes, that's true. You can always go to the hospital, but this is deliberate postpartum care. Like you go before you have a baby, you go to the doctor at first once a month, and then maybe more, as it gets closer. And this is the same after that. You have the money or have the coverage to go to the doctor after regular visits after you have the baby. Sometimes waiting just to run to the emergency room, when you're really feeling bad, it could be too late then.
Yeah, absolutely. You know as well as I how bad maternal outcomes are for black women in this country around childbirth. What does this bill do specifically to help address that?
Well, this bill specifically, again, deals with, more coverage for doctor visits, but I have another bill, the Mamas Act, that deals with collecting the appropriate data to be able to study the issue. It deals with best practices. Why does it happen in some communities or some states much more than it happens in other states? Are there best practices that we can share to form review committees? Philadelphia put together a review committee, and their maternal mortality went down 75%. Also, cultural competency, that it's been many studies that prove you do better when your provider looks like you, or at least understands the reality of your situation. So this is looking at institutionalized racism, biases, cultural competency to make sure that the providers are culturally competent to provide care for moms of color.
Let's stay on cultural competency for just a second. Part of what the data reveal is simply that these are human beings who have been, brought up in a society, live in a society that has racial biases, and those biases they take with them into the medical field. A lot of these black women just do not feel heard when they complain about suffering and pain, and that is just a societal problem that is being brought into the medical field. What can the federal government do to solve the societal problem of bias, particularly when that bias is not a conscious bias but is a subconscious bias?
I think that we need to look at all of our institutions and how we operate, just like we in the medical field. We need to look at a couple things, changing maybe how people are trained, but also we need to have more people of color. We need to do better when it comes to the healthcare pipeline, and that would be the same thing for if you want to look at the tech world or the energy world, that we need to have more diversity at the table to help make decisions, to help guide, what is going on. And I believe, that will help. And we, of course, can pass legislation. You can't change people's hearts, but also you can make them more aware. And I think more awareness, will help change how things are. And you're right about that. Women in general aren't listened to as much. And of course, women of color, the situation's even worse.
I want to talk about your bill one more time. I just want to be specific about this. A study by Mount Sinai School of Medicine in New York found that black women were twice as likely to experience postpartum depressive symptoms as white women, but they're 57% less likely to start treatment for PPD. Would this expansion of Medicaid cover kind of psychological treatments of postpartum depression as well as physical ailments?
Yeah, it covers you going to the doctor, whether due to your pregnancy or having a baby. So that would certainly fit under this realm. And and we need to encourage that. We need to encourage women, if they're mentally not feeling well or have depression after the baby, is very important that they seek help.
I want to switch gears a little bit for this last question. Yesterday you tweeted, "I am fed up with some of my Republican colleagues' disregard for our health and safety. I approached a group of maskless members yesterday because they are putting us and our staff at risk. We should continue wearing masks on the floor until everyone is vaccinated." I can feel the frustration in that tweet. However, the CDC guidance basically says if you are vaccinated, you pose no risk, and they basically pose no risk to you to become infected. Is your objection that it sets a bad standard, or do you really feel that even if you are vaccinated, you are still in danger because they are maskless and we don't know their status?
I feel like it's not just about me, that the DC, the physician we use, the Capitol physician, said that people should still wear masks. All the Democrats are vaccinated, but all the Republicans are not. There's a great many of them that are not. We're not sure if their staffs are vaccinated. It's not fair to the staff and the people that work there every single day, and they need to follow the rules. They were making fun of the rules, making fun of Nancy Pelosi, calling her a dictator. They were being, they said they were exerting their freedom, but they were being agitators just to be agitators, and I feel very disrespectful to the other members and disrespectful to staff. And people with their shots have gotten COVID. They haven't died from it, or the shots have protected them from getting really sick, but still, that's not the point.
Congresswoman Robin Kelly, thank you so much for your time. Thank you for joining me today.
Thank you.
I really appreciate it.
You're quite welcome.
More Prime coming up. Stay tuned.